Hi, Abby. Can you hear me? Hi, thanks to those of you who have popped in already. We're a little early, so we're waiting for everyone, but I'm Deborah Moore in admissions at SCNM. So we'll just wait as we get a few more people, especially Dr. Turner, who will be our keynote speaker today, and my colleague, Sarah. But if you want to start putting questions into the chat for Dr. Turner, or for me, or for Sarah, feel free to do that. We will be using the chat today. If you prefer to actually talk to the doctor in person when she's here, at the end of her presentation, she will take questions and you can turn on your microphone and your camera if you want to. It's up to you, and talk to her directly. But the chat is always a great way to communicate, especially if you have questions that are not for Dr. Turner. Let's say you have generic questions and you want to talk to me and Sarah about like prerequisites or how to apply, things like that. Then when Dr. Turner is done today, then we'll take those questions that are more admissions related. So I'm just going to hang out and wait for everybody to join. I think we have about 6 minutes to wait, actually. I think we're a little early. Yes, we have about 6 minutes. Welcome, Abby. I just read the chat. Hi, Sarah.
Hi, Deb. How are you?
I'm doing great. I'm doing great. Looks like we're gathering a few minutes early, which is wonderful. Dr. Turner should be here, pretty much right on time. I'm kind of excited. She has her baby at home today. And so if the baby wakes up from the nap, we might be getting to see him in person on Zoom, which I would
Oh,
love.
thanks. That would be nice. Oh, very good.
Yes.
How old is
So
her baby
welcome.
now?
Oh, I'm sorry. What was that?
Oh, I was just asking you how old her baby is.
I think like 18, 19 months.
Oh, okay. Very nice.
Yeah, yeah. Somewhere between 1 and 2. I've kind of lost track a little bit, but thank you those who have joined a few minutes early. We'll get started here in about 2 minutes. And yeah, and then hopefully Dr. Turner will, by the time Sarah and I introduce ourselves and give you a little overview of today's meeting, then hopefully she'll be joining us by then. However, in the meantime, if you know you're going to have questions, either for Dr. Turner or general admission questions, feel free to use the chat. You can always go in there. You can say hello, introduce yourself, say where you're from. None of this is required. But if you do have questions that are already on your mind, feel free to put them in the chat. We will. Oh, hi, Dr. Turner.
Hi, I'm sorry.
Oh, no, you're early. You're early. I was just kind of giving them the lowdown, how they can start typing in their question for you already. And if they have questions that don't pertain to you, Dr. Turner, then we will take those when your part is finished. And Sarah and I will answer those afterwards. And I think we should probably wait one more minute because a lot of people really don't log on until right, as we start at 2. And so yeah, we'll just wait one more minute and then we'll start with introductions and Dr. Turner can take it away for a few minutes. Okay, well, my clock says 2, so let's start right on time. Welcome everyone. My name is Deborah Moore. I'm an admissions representative here at SCNM. Almost 10 years, can you believe that, Dr. Turner and Sarah?
Fun.
Yeah, it's gone by so fast. I love it. It's such a great pleasure to get to meet all of you prospective NDs. And Sarah, do you want to introduce yourself?
Sure. So hi, everyone. I'm Sarah. I work in admissions alongside Deb. And hi, Dr. Turner. It's nice to see you again.
You
Welcome.
too.
But yeah, so I've been with SCNM for about 8 years now. So it really is, a wonderful organization. And we're so excited to do these chats and have you learn more about the program and all that we have to offer. So thanks for joining us.
Absolutely. So now, Dr. Turner, as you introduce yourself, I know students are always asking these basic questions. So in your intro, if you want to cover this, the things they always ask is, how did you discover naturopathic medicine? Why did you choose to become an ND over, say, an MD or a DO? Why did you choose SCNM? And tell us a little bit about how you got started with your medical center. What was the process for you to arrive where you are today with this fabulous, wellness center that you have? So I'll let you go ahead and start up with that. And then for all those listening, we offer Q&A. Please put your questions in the chat for Dr. Turner, and we can address those after she does her monologue. Take it away, Dr. Turner.
All righty. Hi, everyone. So I grew up in Northern California. I grew up kind of out in the boondocks. Like I was in a town with like 500 people and my high school had 40 people. So I kind of grew up already in the alternative world of small, tiny towns. And I fell in love with herbal medicine in high school. I stumbled across this natural history class. And again, my high school had 60 people, so it was extremely small. So I was in love with herbology right off the bat. And then my story is kind of unique. My father actually wanted to go to naturopathic medical school. His undergrad requirements were too old, so he ended up going to homeopathic school instead. But he introduced me and told me about naturopathic medicine when I was in high school, which was back in 15. And I'm sorry, that was back in 19, oh my God, what? When was high school? I graduated high school in 1998. So this would have been in 1995 that he introduced me to naturopathic medicine. So when I went to college, I already knew about naturopathic medicine and I knew I wanted to do it. It was kind of an unusual thing. I went and checked out Bastyr. I made it through school in undergrad and I made sure all my undergrad requirements would fit wherever I wanted to go. I applied to National, Bastyr, and SCNM. And I went and visited all 3 schools. I applied to all 3 schools. I got into all 3 schools and I ended up picking SCNM. And I very clearly remember, there were 2 main reasons I picked it. One is I was done with the Pacific Northwest fog. I grew up in the fog. And the other reason I picked it was because at the time, SCNM's technological advances were by far exceeding the other schools. All of their classes were online. All of their notes were electronic. And I am kind of techie, and I really was attracted to the fact that all of the classes were online. I loved the campus. I loved at the time, the medical center was the older building. Now the new building is beautiful and gorgeous. So that was why I picked SCNM. And I think I answered most of your questions, so I'll go into my journey. I graduated from SCNM, and then I stayed and did my first year residency at SCNM, and then I stayed and did a second year residency that had a focus in women's medicine. And it was halfway through the second year residency where I got a job offer at a doctor's office in Scottsdale, and they were willing to wait for me to finish my residency. And it wasn't halfway, it was a little more than halfway. And so I joined the practice while I stayed on as adjunct faculty at the school. I loved teaching students. I absolutely loved it. I discovered that when I taught someone else how to do something, I figured out if I knew what I was talking about, right? Because when you teach someone else, you're like, I don't know what I'm talking about. I'm clearly missing something. And then you got to go back and study it so that if you're going to teach them or supervise them, it becomes really clear to you if you know what you're talking about, because you cannot BS your way through this. So I stayed on as adjunct faculty and had a rotation where I would supervise students seeing patients. I was adjunct while I was in private practice. And this was challenging, I'm going to be honest, because I basically had 2 jobs, but it was also really rewarding, and it was helpful to have resources to still be connected with SCNM while I was building my private practice. And I did that for a number of years. I actually ended up becoming full-time faculty while I was still running my private practice because I loved both and I refused to give up one. So I was super busy in private practice 3 days a week, and I crammed all of my full-time requirement hours into 2 full days. I was on campus from 8 till 10 p.m., 2 days in a row. And I helped create the new curriculum, the clinical practice curriculum that is still now part of the new curriculum at SCNM. So I helped implement the first 2 years of that clinical practice curriculum. And then eventually it became too much and I couldn't continue with both. So I let my full-time position go at the school and focused really on private practice. And then I got really busy in private practice. I was there for a total of 9 years. And then I jumped off the cliff and started my own medical center, which was now 5 years ago. And I've been running my own medical center for the last 5 years. Now I have a resident who just completed her 2nd year residency. And I have 3 other physicians that have their practices at the office. And I have a new resident starting hopefully in the next 2 weeks because she just found out she passed boards. So there's my story and my journey, and I'm happy to answer questions and tell you more. But I'll give a moment of space to see what questions you guys have.
And you all are welcome to write your question in the chat, and I'll go ahead and read it to Dr. Turner, or you can turn on your camera and your microphone and just ask this way. We're a pretty small group, so that would be fine too.
And while we're waiting for questions, Dr. Turner, I know that what students often, really want to hear about is if you can go back to when you were a prospective student and the type of things that you wish you had known prior to starting the program that would have been helpful, that would be helpful to them now, just kind of basics, that maybe that information wasn't coming forward and you wish it had been. And so you can do that for them. And also about the actual practice and setting up your practice, some of the nuts and bolts, because they're often concerned, about that, about getting a job, about starting their own practice. So if you want to elaborate a little bit, that would be fabulous.
Sure. Well, in terms of what I wish I knew, to be totally honest, thinking back, I feel like SCNM and the profession in general is pretty good at giving you lots of information. I was bombarded. I always remember school to me felt like drinking from a fire hydrant. That's what it felt like. So I feel like I was aware of everything that was out there. So instead of saying what I wish I had have known, I'm going to say what I think really helped me, which was following my passions, following the things that interested me, and seeking extra training on the things that interested me, which in the beginning is easy to do because you're so excited and you're so passionate. I was going to talks all the time. Take advantage of the student discounts because later all of your CEs cost way more money. And as a student and as a new doc and a new grad, all of the state associations have way cheaper rates. So as a brand new grad, you could be going to conferences and they're way cheaper and you can be saving those notes. I still reference notes from conferences I went to years ago. I was a part of a whole bunch of student associations. I was actually one of the founding members of the NMSA, which is now the Thriving Naturopathic Medical Student Association. There were 6 of us and we got that set up as a nonprofit. If you plan on ever wanting to open your own medical center, then the type of person you probably are is the type of person that should be joining those associations early on and getting involved. There's mentorship programs, I'm sure that still exist at SCNM, where you can mentor your underclassmen. And if you have a passion for teaching, which as a doctor, like that's all I do all day is teach my patients. So most of you probably do have a passion for teaching. So if you know you have that passion, then get involved with an association or the mentorship thing where you're teaching your younger classmen, because as soon as you can start mentoring classmen younger than you, you are turning on the part of your brain where you're learning how to teach and mentor people. I was a part of there was a philosophy group. So the more active you can be, I think the more connections you're going to make and the more resources you're going to have moving forward. So that would be the answer to your first part of your question, Deborah. And then sure, I'm happy to talk a little bit about the practice. So my passion is hormones in the gut. Those are really my passion. I treat a lot of gut stuff. And the reason I treat gut stuff is because so many chronic conditions stem from gut problems. So you can treat the majority of what walks in the door if you're good at treating the gut. The immune system is in the gut, our metabolism is in the gut. And so many of our chronic conditions have to do with what people eat. So one of the hardest things I do is teach people what and how to eat. It's the hardest thing. And if there was one other thing that I wish I had in my practice right now, and I'm kind of trying to figure it out, but I have my resident, so I'm probably going to use her, is to have a nutritionist, because that's where people need more help, is they need help with what to eat. So my passion is hormones and gut. I talked about gut. Hormones is my playground. I absolutely love all hormones, thyroid hormones, adrenal hormones, and all of your sex steroid hormones, estrogen, progesterone, and testosterone, especially now because it's like the hot topic, and hormone replacement therapy is the hot topic. People come in now asking for hormones, whereas before, when I first started practicing 15 years ago, naturopaths was still so new then that usually patients didn't already come in knowing what they have heard about and the new thing. Practicing medicine now with social media, it's so different than it was 15 years ago. So my practice, I have an IV room. I'm doing IVs all the time. We have a exam room. I do gyne exams. I do hormone replacement. Hormone replacement is when you're giving somebody hormones, usually in menopause or perimenopause, and the hormones are estrogen, progesterone, and testosterone. And those hormones can be done as a cream, which I prescribe at a compounding pharmacy, capsules. Again, we can prescribe in Arizona. One of the reasons that I set up shop in Arizona is because our scope of practice is so big. We can practice everything here. We can do minor surgery. I do acupuncture. I do a lot of, as I said, diet and lifestyle counseling. A lot of supplements. We probably have 300 supplements on site that we sell out of our medicinary. And then I use a lot of medicinal herbs. So I have a whole bunch. I probably have 200 herbal tinctures that I will pick which herbs I want. I pick 6 herbs or 8 herbs, and then I pour them in my little Harry Potter bottles and make them magical herbal tinctures that help them.
Very cool. As a follow-up to that, Dr. Turner, what you do in your practice, it does correlate, although you didn't specifically say it, but a lot of our prospective students, as they think about what they want to do as an ND, we do get a lot of prospective students who have a background in aesthetics. They might have been an esthetician. So they're interested in anti-aging and all the various services or modalities of natural healing that can help with beauty. Because obviously the healthier you are, the more beautiful you are. I mean, that correlation is quite factual. So if you want to elaborate a little bit on that as well, the aesthetic piece in naturopathic medicine.
Yep. So the primary thing that I do that is an aesthetic practice is I offer PRP facials. So PRP is when you take the person's blood and you spin it down, and then you separate out the part of the blood that's rich in the platelets, and then you can inject that back into the tissues to help with regenerating whatever tissue you inject it into. If you're interested in pain management or sports medicine, there's a lot of PRP injection into the joint that can actually help with joint regeneration. I will rub it on the face, and then I use a microneedling device that will inject it into the face. We do offer Botox, and then we don't offer any of the other aesthetic services. We don't do fillers. I don't at this point, enough other people in the Valley are offering those that I just refer. I've been interested in them, but I have to say you kind of have to pick what you're most interested in, because you can't be an expert in everything, or you can't afford to maintain having all of these things in the office offering everything. If you're not selling enough of it, then you can't continue to sell it in the practice. So at this point, we're keeping it simple: PRP, facials, and Botox. From an anti-aging perspective, my favorite way of being anti-aging is hormones. Hormones are anti-aging because all hormones decline naturally with age. And so helping set somebody up with kind of optimal hormone levels early on is to me, it's treating the underlying cause of aging. So to me, that is the most effective way of doing anti-aging medicine. The other thing that we could throw into that conversation is just general functional medicine. I think functional medicine is now a word that's getting a lot of talk. And really, functional medicine is about assessing underlying function and treating root causes. So, naturopathically, we're trained in a lot of functional laboratory assessment, like neurotransmitter measuring and rebalancing. There's lots of gut assessments you can do, comprehensive stool analysis tests that are looking at the gut function and the microbiome that live inside the gut, and making sure there's plenty of diversity of the bugs. So all of that type of functional testing is also something that, to me, it's part of anti-aging. If you're not fine-tuning the system, then the system is aging more quickly.
Excellent. Well, thank you. Sarah, do we have any questions yet in the chat for Dr. Turner?
I don't see any questions, but I did want to mention that I did put Dr. Turner's website in the chat. So livingwellnessmedicalcenter.com, if anybody wants to check that out and learn more about the services she offers, and maybe that will prompt some questions as well.
Excellent. And Dr. Turner, some of the things that prospective students are often trying to seek, so they know if this is the right fit for them or not, is they're hoping to shadow a naturopathic doctor. Of course, we used to, prior to COVID, we offered that at SCNM. We had students come and shadow our NDs all the time. And I don't know if you ever offered that or if you ever would in the future, if that would be something that would be helpful.
Oh, I have had hundreds now of students shadow me. And it's definitely something I'd still be open to. It would just depend on who and when and where things are at with COVID and where my current resident is at with her training. But absolutely, if you guys are looking for shadowing, definitely reach out. Probably the best way is to reach out through the office. And then depending on where things are at with the state of the state of the world, I say I offer it and I would do it. It's just going to depend on when.
Excellent. Well, I know what we had to go to were these Zoom meetings, obviously. Yeah. And what some of our alumni, such as yourself, have done is they've also offered, short Zoom meetings, almost like an informational interview type of thing. For those who are out of state, especially, I don't know that you'd have the time, you're so busy and you have a young child, would you have the ability to do like a 5 or 10 minute informational interview type of format?
Yeah, I've also actually had some virtual shadowing happen where I just have the student basically shadow me virtually on Zoom on my iPad sitting on my desk and listen to the console, which is not as great as being in the room, but it, given the situation, given what's going on, it's a good option. It's a good backup.
That's excellent. Thank you for making that available. I think most of the people that are with us today, as I look at the names, I do know some of the students. I've had interaction with them. I would say the majority are from out of state and not in state. So if we've provoked any questions now and you just want to turn on your camera and turn on your microphone or just your microphone and talk to Dr. Turner directly, feel free to do so.
So Deb, I do see we have a question here and on the topic of shadowing, especially being out of state. So this person says that they haven't had any luck with shadowing in New York. Any recommendations? Currently, they're getting most of their direct meetings on this type of Zoom meeting. So I can think of one of our graduates practicing in New York in Long Island. So I can certainly email you her information. But I don't know if Deb or Dr. Turner, you know of any others?
I don't personally, Sarah, but I will mention that the Association of Naturopathic Physicians in New York, so you have to write the whole thing out, Google that. And when you get to the homepage for the Association of Naturopathic Physicians in New York, or whatever state you're interested in, but in this case, New York, usually up at the top, towards the top right, it'll say find a naturopathic doctor or find an ND or find a doctor. You click on that and it'll have a whole list of NDs, and maybe you can find one that's closer to you. Was New York the right state? Did I hear that correctly?
Yes, New York is what they said, and I'm putting the New York Naturopathic Physician Association website in the chat here, so they can just click on that.
Excellent. Yeah, now, not every state has the association, though, unfortunately.
What were you going to say, Dr. Turner?
I was just going to say, in terms of shadowing, when I have students shadow me, I think that, like, I don't want to tell you to be too annoying, but I will say that the squeaky wheel gets greased, right? So if there's a place that you gently and very respectfully bug, and just tell them, you write them a letter, tell them about yourself, say, I've tried to shadow, this is what I'm wanting to do. I think that just having been on this side, we're coming from the perspective of being fairly busy and trying to, with COVID, it makes it hard because we're trying to protect and limit traffic in the office. Right now, we are requiring vaccinated people, where we are requiring, if I have students shadow in the office, we are requiring that they're vaccinated. And I know that's a hot topic, and I know there's pros and cons, and it's not something we necessarily need to go into today. But at this point, it very clearly is what we're doing. So if you have a place that you can reach out to ask about shadowing, respectfully, be very respectful, but the squeaky wheel also does get a little grease. I'll just say that.
And so just to follow up on that, since it came up, I do see another question here in the chat asking if COVID vaccines will be required for entry now or in the future. So I know we do have a new policy on that just came out this week. I'm still learning the details myself. There will be more information on the website soon. Deb, do you want to add anything to that?
Yes, I would just say we're kind of waiting for that wording to be precise. We've been in a meeting, but it's a little bit complicated. It's not simple like, oh yes, everybody has to have the vaccine. It's not that simple. That would be easy for Sarah and I to share. It's actually a little bit complex. So we're going to wait until that wording is put on the website. It would be as early as late today or hopefully tomorrow. If it doesn't make it on the website today, and those of you who are already, in our database, and all of you are, you would receive an email with the information, especially if you plan to start this fall, which is, in a couple of weeks, or if you're starting in spring, which would be April of 2022, because you'll get a direct email as quickly as possible, because you'll need to know all the various options that you have. And so I don't think Sarah or I feel confident enough to explain it because it's just not simple. And so we're looking forward to all of us receiving it.
All the schools, my understanding, is going to be are requiring it. So it's not just SCNM, like I think all schools are.
All ND schools, you're correct. But everybody's a little bit different because of the way the state has various rules as well. And so they have to balance the state. And now President Biden has also issued some information. And so it's, there are, I don't want to say this too strongly because I don't have the wording in front of me, but there are options for students who are starting this fall to have, what is the word they're calling it? Medical waiver or religious waiver. And we don't have those waivers in front of us. I'd love to tell you more about them, but we haven't seen them yet. So I don't really know exactly what it means, but I believe Bastyr has their medical and their religious waiver on the website. Now, I haven't had a chance to look at it, but I would imagine ours would be very similar, but they're a little ahead of us, Bastyr. And so you might want to look at their website because I think ours will be similar, but it won't be exact. So do wait until the end of the day or tomorrow and then check the website. There should be a banner, COVID update, and then you'll have it all in writing and it'll make a lot more sense than Sarah and I trying to, give you very vague information, which isn't that helpful.
Thanks, Deb, for that. Yeah, we do have a couple of questions here. So this person is saying that they would be moving from out of state with a family, 3 small children. And so they're wondering, can you help me picture what my day-to-day is going to be like at SCNM? So Dr. Turner, do you want to speak to that a little bit?
Yep. I think the more important question is what's your day-to-day life going to be like after SCNM? Because we all think at the beginning, all you can think about is what's it going to be like there. But so I'll answer both. So your day-to-day life for the first 2 years, you are in lecture all the time. Lectures would usually start at 8 o'clock in the morning. You'd have breaks every either 45 minutes or every hour or something like that. You pretty much always bring food and snacks with you, and you're snacking and eating and lecturing and studying all the time. That's pretty much all you're doing. There's quizzes in your courses all the time. I used to have really bad test anxiety, and by probably quarter 2, I pretty much figured out you can't deal with test anxiety because you have a test every 3 to 7 days because there's quizzes and quizzes and quizzes and quizzes. And there's no such thing as midterms and finals because you have quizzes all the time. So you kind of become immune to it and you get good at cramming. assimilating, and filling out a Scantron. So the first 2 years is like basic sciences intense. Then clinic starts and it really gets fun then, because then you're starting to work with patients, and you start out as a secondary student where you're observing the primary student take care of the patients, but you're still involved in the case. And then you graduate into the primary position where you're then the person taking the primary role, taking care of the patient, reporting back to your supervising doctor. In the third year, you start clinic, but you're still also getting classes done. So lots of classes and lots of clinic. And by the fourth year, you don't have that many classes left. You're mostly doing a lot of clinic shifts. So that's, I think, how I would describe your experience on a day-to-day. Clinic shifts can happen in the evening. I know that those have changed since I went to school, which was a while ago, but I do know that there are still some evening clinic shifts. And then I'll tell you how my day is now. We start blood draws. I get to the office at 8. We do blood draws from 8:15 until 9. I start seeing patients at 9 o'clock, and I see patients from 9 to 12. My consults are either 15 minutes, 30 minutes, or 45 minutes, and they're either on the phone or in person. Right now, we have a whole screening process we do for COVID that we call them prior to coming and ask them a whole list of questions before we let them come on site. We have an hour break from 12 to 1, but I'm usually 10 to 12 minutes behind. And so I usually start lunch at about 12:15. And then I usually take 5 to 8 minutes to prep before I start at 1. Sometimes I have a longer lunch and sometimes I'm not behind. But then I start seeing patients again at 1, and I usually I used to go till 5. And I do not do that anymore. Now I stop at about 3:30. I have about 45 minutes of admin and catching up, and I'm out of there by 5. And that's not how it has always been. I used to be there till 7 many, many nights, but I have a 2-year-old now. So that was the other thing along the way, is I wasn't sure how I was going to pull the family and the business off, and I pulled it off. I saw lots of people go through school with kids, so it can be done. I was a late mommy, so I have a 2-year-old now, and it's magical. So all moms should be thanked more often.
Well, you know, Dr. Turner, that ties into another follow-up question here about the quality of life. You know, maybe as a student or as an ND especially, it sounds like, you know, you have your schedule works out so that it's pretty much 8 to 5. So it sounds like a pretty good, you know, work-life balance type of situation, wouldn't you say?
Yeah, when I was in school, one of the things that I did was I was a rock climber. That was my workout. I didn't go to the gym or anything. I did rock climbing in a gym, but I didn't. So for me, what kept me sane through school was working out. It was incredibly helpful. I had to get out. And so I would go and climb at the gym like Wednesday nights, Friday nights, and Saturday and Sunday. And I did that for most of school. I did that for most of the residency. And it was kind of one of those non-negotiable things. Whenever I stopped, I loved studying so much that I could overstudy. I could overburn myself out and get brain fried. So I would recommend using physical activity. Plus, it's one of the best ways to continue to take care of your body is to move. You know, we spend all this time during the day thinking and thinking and thinking, but if you're not moving, you're not using the other part of your existence. So I was not having to take care of a family through school or through residency. It was really just me taking care of myself. Now, I was definitely overworking for a number of years there. I was burning the candle at both ends. I got burnt out. And then when I started my own business, now it was a whole different thing to tackle, because now it wasn't just about taking care of patients and knowing what to do as a doctor. It was also, I got to pay my bills and I got to pay my receptionist and I got to know what I'm doing with running the business. I'm actually putting together a mentorship program for new grads that's going to be like a 4 to 6 month committed mentorship program for new grads to help them walk them through the process of becoming a doctor and B, if people are wanting to start their own business. Because yes, we had business classes in school, but I was not prepared to start my own business when I graduated. I will say that. I worked in another doctor's office for 9 years where all I had to do is practice the medicine. And for me, it worked out perfectly because I could really just focus on studying the medicine and learning how to be the doctor I wanted to be. And then later, when I opened my own medical center, I got to focus on running the business and learning how to do the business. So I'm a huge fan of mentorship. So, and there's plenty of people to be mentors. Having a kid changed things a bunch for me. And now I probably have the best life-work balance I've ever had, because now it's not just about me.
Yeah, that's great. And I think that's what most of our students do once they graduate, is they end up joining an already established clinic practice, working with other NDs. So they work together as a team. You know, there's not so much pressure on having to manage your own clinic and your own practice right away. So just so everyone knows, that's what we most often see happen.
Absolutely. Well, Dr. Turner, we want to, honor the time commitment that you've given to us. We've gone over a few minutes, but thank you so much for sharing. I know I got a lot out of it. I bet the prospective students really loved it. And you've had such an amazing journey in naturopathic medicine. I'm so excited to hear that you're going to start this mentoring program as well. So thank you again so much. You might have some of these prospective students contact you then through your office, as you mentioned, to reach out. So.
Yep, if you want to find me on Facebook too, it's Dr. Leila, one word, Turner. And feel free to say hi on there.
Excellent. All right. Well, have a wonderful rest of your day. I was hoping your baby was going to wake up and we were going to.
I know. I'm watching him. He's still lying here, and he kicked around a little bit, but he hasn't moved.
Oh, he was out cold.
Yep.
All right.
I intentionally kept him up. I was like, you have a late nap today. It worked.
Perfect. That is so perfect. And prospective students, Sarah and I hang around. So if you have like generic questions, like what are the prerequisites? What does it take to fill out an application? We'll hang out for a while, but we'll say goodbye to Dr. Turner, and thank you again so much.
You're welcome.
Have a great rest of your day.
Good luck. If you have more questions, I am happy to answer them on Facebook.
Beautiful.
Hi, thank you.
Again.
Bye, Deborah. Bye, Sarah.
Bye.
Thank you.
Bye, Dr. Turner. All right. Well, do any of you have any questions? Do feel free. There's just like, I think, 8 of us here. So feel free to ask any questions of us that you would normally want to know about admissions, or actually anything. We're kind of generalists.
So I see Rebecca's asking about prerequisites. So Deb, if you want to talk about that, and then it looks like Lena has a question as well. So Lena, you're welcome to write the question in the chat or turn on your camera after Deb addresses the prerequisites.
Great. So the prerequisites are pretty basic. A bachelor's degree in any college major. It used to be it had to be biology pre-med. Well, those days are over. If it's a non-science major, we do need you to make sure that you pick up the chemistry classes and the biology that we do need. So if those classes are not baked into your degree, like a biology pre-med, then you'll need 3 biology classes, each with a lab. Pretty open about which biology classes those are, but we do need 1 class in organic chemistry with a lab and 1 class in biochemistry. Now, the biochemistry is the only science class where the lab is optional. And then for those of you, if you got your bachelor's outside of the United States, and I don't know if we have any of our international students on the call right now, but I can talk about, but if you're all from the United States, then I know that you already have all the other prerequisites. If you want a free pre-evaluation using your unofficial transcripts so that we can tell you where you stand, and if you meet our requirements or if you still have something left to take, feel free to email them to me. Your unofficials are free from your college, and my email is based on my name, and I'm Deborah Moore. So it's d.moore@scnm.edu. And my
Can you
last name
type
is
it?
Go ahead.
Can you type it in chat box?
Yes, Sarah, can you type my email into the chat box for me?
Yep, I'm doing it right now. Just a moment. Let's see. Yep, there we go. So you should all look in the chat box, and there's Deb's email address. And so you can feel free to email her your unofficial transcripts.
Great, thank you. And then who else? Lena had a question?
Yeah. So I'm actually a medical doctor, MD. I have 14 years of international work experience. I'm licensed in 6 different countries. And I don't know how to say it to you. I'd like to franchise what you're offering. Like I'd like to franchise the institute.
Oh, like start another campus? Am I understanding you right, like that?
Sort of, yeah, sort of. Because I'm delivering this kind of teaching internationally while I'm not indie, I'm indie.
Yes, okay, I understand.
I also would
So-
like to say, since I'm licensed in 6 different countries, that you guys are quite focused in America, North America. I'm located in Canada right now. You are focused on this area while you can click much higher where else you are open to discuss this.
Yes, we know that we have 2 of our fellow accredited ND schools are located in Canada. They've kind of combined forces. Canadian College of Naturopathic Medicine in Toronto and Boucher in Vancouver. Not very many ND programs have opened additional campuses. Bastyr had their original campus, or still does, in Seattle, Washington, but they about 6 years ago, I think now, they opened up a branch campus in San Diego, California. But just to let you know, Doctor, there is and you know this already, but I'm going to say it to the other students. There's a naturopathic medical board that determines who meets accreditation and who doesn't. And they're very strict. And so, Sarah, do you remember the exact name? It's like the Naturopathic Board of Medical Examiners.
I mean, I just know that the board is the NCLEX board examinations, but I don't think I can remember what you're referring to.
It's NMBE, and they are the accrediting board that examines SCNM and Boucher and CCNM and all the other accredited ND programs. And so, Doctor, to answer your question, I think that you would have to approach them in order to see what it is you would have to do in order to be able to start an accredited facility of naturopathic medicine maybe on an international scale. I don't know, that's confusing. Canada and the United States, as you know, have reciprocity, but other parts of the world do not. So I think it would get very complicated. You're licensed in 6 countries, so maybe that would help if you wanted to formulate that. But what I think I'd want you to do is if you could put your request in an email to me, and maybe I can forward it either to our president or someone else who would be able to help you better. You know, Sarah and I, we're at a level where we don't really have that kind of knowledge, but we could get you connected perhaps with people above us that could be more helpful.
Sure, yeah, sounds great.
Okay. There might be other questions in the chat. Let's see, what do we have here?
I'm not seeing any other questions.
Is it ED? Oh, I see, Sarah.
I made a little typo. I think I'm still in vacation mode, but so to clarify, Deb's email address is d.moore.
It is edu.
scnm.edu.
Getting a message that my internet is unstable. Am I popping in and out for you guys, or can you hear me okay?
I can hear you okay.
Oh, good. Oh, good. So I guess the connection's back. So yeah, d.moore@scnm.edu is that. And we're coming up on it like 2 minutes before we end. So if you do have any questions, feel free to jump in. But remember, we do this every 2 weeks. And so we'll have another topic coming up. I see Fernando. Do you have a question? Let's see. I'm applying for SCNM soon. What was the rest of that question, Sarah?
I'll go ahead and read it. So he's applying for to SCNM soon with the start date of fall of 2022.
Okay.
So currently taking the prerequisites, will the school accept me pending the completion of the prerequisites? For instance, I would move to Arizona a couple months prior to start the school, but I don't want to sell my house here in New York and move to Arizona without knowing.
Yes, excellent. So we do allow you to apply and get admitted a whole year before you're ready to start, if you'd like to. And a lot of students want to for the same reasons that you just said. You want to know that you have been admitted. Now, we call it conditional admission status, because if you're still completing your prerequisites, we're not going to give you full admission status until you send us a final transcript proving that you have completed those courses successfully. But you are allowed to apply before you're done, a whole year before. So you can start September of, actually, I think it's Monday, we're opening up the application for fall of 2022. So let's say next week you want to start the application, but you're not going to be done until closer to October of 2022, which is when you intend to start. You can fill out the application when it opens up. You can be invited to interview. You can interview. You can be granted conditional admission status. You can pay the deposit, and you are ready to go. We're holding that slot for you. Now, let's say, something unfortunate happens and you're not able to complete your classes, or you don't get a passing grade. I mean, every once in a while that happens. Well, we can't promise you can start unless you definitely complete the prerequisites and complete them successfully. Does that make sense, Fernando? Do you have a follow-up question about that?
And he says, great, thanks. So
okay, good deal, good deal. Any other questions? If not, remember, in about 2 weeks, we'll have, we haven't put all of the next upcoming Discovery virtual chats on October, November, December yet. Sarah and I are still working on those schedules, but they will be up and running very soon. And so, and of course, the Smoothie social hours, there's still, I think, 1 or 2 left here in September that you can take advantage of. And then we do have various career presentations and things as well that you'll get via email if they're not already on the events calendar. Any last questions before we sign off and look forward to seeing you on the next virtual chat?
Thank you.
Thank you. Thank you all so much. Have a great rest of your day. Remember to email me, Lena, so I can forward that. Okay, doctor. All right. Take care, everybody. See you next time.
thanks, bye-bye.